Hi everyone, it's Patricia with Mental Health Matters. Don't forget you can see me on YouTube now with A Slice of Peace with Patricia. This month we're discussing addiction and we're talking about the various types of addiction starting tonight with alcoholism. If you missed my last video, please don't hesitate to go back on Instagram or to YouTube. Again, A Slice of Peace with Patricia. All right, so let's start with a definition of really what is alcoholism. Alcoholism is a chronic disease with uncontrollable drinking with a preoccupation for alcohol. So it's uncontrollable, which means that once an alcoholic begins to drink, he cannot stop. There's also a mental component in which he or she is constantly thinking about when they can get to that first drink. So alcoholism is a severe disease that is chronic. It can start at age 14, which is when most alcoholics report having their first drink. And that drinking includes, junior high, all through high school, after all of the social events, and into college. And as I said earlier, it is progressive, which means it's going to get worse over time. We also know that it is terminal. This is such a severe disease that ultimately it can kill and destroy people. And there's no cure. I wish there was, but there isn't any magic cure for this disease. I'm going to give you a list of ways in which you can manage it and get help in my next video. But for right now, I want to be really clear about what we're talking about in terms of what is alcoholism and who may have some of those signs and symptoms. So let's begin with, where did it come from? As in all mental health conditions as well as addiction, it's in the family somewhere. Somewhere back there, grandma, grandpa, great-grandma, someone had a biological or a genetic link or a predisposition for an addiction such as alcoholism. Now remember, addictions come in many different shapes and sizes. It could be gambling. It could have been hoarding. It could have been workaholism. It could have been pornography and sex. It could be shopping, gambling. There are lots of different forms that addiction takes. But tonight I'm going to continue to focus on alcoholism. Now, what is the genetic link? Well, mostly it's all in the brain. If someone back there in the family tree had this addiction going, then it is very likely that it will skip generations also, so that if a grandparent had it and then that child chose not to drink, having lived in an alcoholic home, it could then show up in the next generation. And so we know that also it can be environmental. A child watching a parent drink every night into intoxication can have a lasting effect. It's giving the signal that this is ordinary and normal and that it's okay to begin drinking at an early age. And so we know that combined with genetics and the environment, we have a very difficult and baffling and powerful addiction called alcoholism. So let's dive into some of the symptoms or signs of alcoholism. There are certain questions that most physicians, counselors, and therapists will also ask an individual whether they have an ongoing alcohol issue or not. So let's get into some of these questions. All right, the first one would be, do you have an overwhelming desire to drink? Do you have an inability to stop drinking once you start? And this is where we separate the social drinkers, or those that can enjoy a drink once in a while, from those that are alcoholic. An alcoholic, once they begin drinking, cannot and usually will not stop on their own accord. Intoxication normally leads. So that would be our second question. Are you experiencing any withdrawal symptoms once you start to think about stopping alcoholism? And what are some of the withdrawal symptoms? Well, certainly an increased heart rate and sometimes heart palpitations. We see some memory loss. We see an appearance that becomes more and more disheveled. We see a loss of interest in other activities and interests and hobbies. We see a desire for the individual to push everyone away and to isolate. We also see that the person usually gets very defensive when approached with, "Is this a problem?" and also very angry and irritable very often. Also, we get to see an individual who can attend a function and will not stop drinking until he is fully intoxicated, and that pattern of behavior is seen more and closer together. A physician will also ask if the individual will continue to drink despite all the evidence of a negative outcome, with no regard to risks or consequences. And lastly, a physician is going to ask about tolerance. And what does tolerance mean? It simply means that the individual has to be able to drink more and more and more over time to reach a certain point of feeling good or feeling high, or getting to that place where in their mind they're usually very attractive or very funny, or a sense of inner peace where some of the anxiety is coming down. So those are some typical questions that most physicians will ask, and a diagnosis then will be made. Most alcoholics are able to identify and self-diagnose. The evidence is pretty clear. Once they stop thinking about the obsession and the compulsion to it, it really takes over, and they can't really stop drinking. So it impacts families and relationships. It hurts jobs and responsibilities, and certainly all of the obligations that are involved in everyday life. We have noticed a tremendous increase in the drinking and alcoholism due to the pandemic of 2020. So even in the UK, they have asked people to do a dry January to see if they can get sober for 1 month. If you feel you cannot stop drinking for a week, let alone a month, then perhaps there really is an issue that you need to take a hard look at. Alcoholism can be very destructive. It can be very terminal. People die from alcoholism or driving behind the wheel of a car. It usually ends up in 3 different places, from what most alcoholics will say. They will end up in a hospital bed, they will end up in a prison cot, or they will end up in the morgue. So we're going to keep on talking about alcoholism. I think it's a really important discussion and something you should have within your families, with your friends, and certainly with your community. So I'm going to stop here. I don't want to go on too long. That is clearly what alcoholism is and some of what the signs are. Let's take a look again next week at what we can do, what are some of the interventions, what is available. But I also want to talk about some of the physical, mental, and emotional effects that long-term alcoholism will have. And certainly another increasing concern that we all have in the field of healthcare is alcoholism and women. We have seen a tremendous increase in this addiction with women, and I certainly want to talk about that. Please don't hesitate to leave me a question or a comment. I'm here for you. This is Patricia with Mental Health Matters. I hope this has been helpful. And remember, there's tremendous amount of help available. So I'm definitely going to emphasize that tonight and ongoing in our discussions. All right, make sure you check out A Slice of Peace with Patricia. And stay tuned. Thank you so much for following me on Instagram. And I'll see you next time. I hope to be back real soon with more information. You take good care and stay safe. And thanks again. I'm so very grateful for this opportunity to be with you tonight. You take good care, and we'll talk soon. Bye for now.